Parkinson's disease or Parkinsonism is a disease of the central nervous system, and the cases of this disease are really on the rise in today's era, where with the level of work that people have to do nowadays and the increased level of stress is having very damaging impact on the neurons of our body. As a result, the cases of this disease are increasing day by day. Now, when an individual is suffering from this disease, we can say that right at the start of this disease, if somebody asks when exactly he or she can judge that he's about to become a Parkinsonism patient, the symptoms may be virtually nothing. It might be a mild tremor in one of the arms at times, which generally is ignored. So the simple mild symptoms of Parkinsonism, which may develop in the very early and beginning stages of this disease, may be ignored. And then gradually the symptoms increase, and they may increase to large amount of tremors in the body, stiffness, and in extreme stages inability to write. The symptoms can worsen with each passing day. Now why does Parkinsonism develop? The major reason for that is that in our central nervous system, the neurons, when the neurons are to send a message from one neuron to the other neuron, there are neurotransmitters like dopamine which are required for that. As aging occurs in the body, and also due to certain hereditary factors, stress factor, dietary depletions and all, when the level of dopamine that is required falls below a certain level, one neuron is not completely able to pass on the message to the next neuron. And that is from where it all starts. Gradually, the neurons, they become non-functional, and as in the allopathic world today, it is almost impossible for a neuron which is non-functional to regain functionality. That is the major reason that Parkinsonism is up to some extent manageable in the allopathic treatment system, but then not curable. And also in majority of the patient, the condition is seen to worsen with time. In no case, much improvements or much good prognosis has been observed. The major drug of choice which is given in allopathic treatment to the patients are basically meant for increasing the dopamine level. In no way those drugs are not important. They are important because in case we are able to increase the dopamine level by any methods, it is definitely going to help. But then the underlying reason, if we are not giving anything for underlying reason, slowly and gradually the medications that are being given, they become a bit ineffective. Here in Ayurveda, Parkinsonism is mentioned to as Kampavat. It is one of the Vataj Vyadhis that has been mentioned. And when we talk about Vayu, Ayurveda believes in the doctrine of Vata, Pitta and Kapha. And when it's Vayu, all the movements of the body are controlled by Vayu. For Vayu it has been said Ayur Balam Vayu, Vayu Dhatu Shririnam, Vayu Vishwam Idam Sarvam Prabhuscha Vayu Prakritita. That is the importance of Vayu that is mentioned in Ayurveda. So, when we treat Parkinsonism as Kampavat, it is basically Vayu Nashak Chikitsa that we are doing. There is Vata pacifying treatment that we are giving. And in our treatment, we increase the microcirculation. Then we increase the level of neurotransmitters. Along with that, medhyarosines. Medhyarosines are something which are just giving astonishing recovery in patients suffering from Parkinsonism. So Medhya Rasayans are used along with it. When we talk about Medhya Rasayans, these are mentioned in Charak Samhita, and it is talked about Medhya Rasayans. Manduk Parni Swarasa Prayojya, Kshiren Yashti Madhupasya Churnam, Raso Guduche Astu, Sa Mool Fal Pushpa Khalu Shanka Pushpaya. These are 4 herbs which are mentioned to be taken in different types for improvement in Parkinsonism. And when we are giving treatment of Kampavad is almost completely reversible. The patient can slowly and gradually return back to normal life. Along with the medication curriculum, there is lifestyle modification, certain pranayams and dietary recommendations that are equally important. So that is what is done in case of Parkinson's. Along with that, in extreme cases, the patient can opt for Panchakarma therapies. So these all, if combined, can really change the lives of a Parkinson's patient.